You've had cesarean section in your first pregnancy and you are now pregnant with your second baby and you are considering giving birth to your child vaginally. Before you go into that, let's talk about something. Hello everyone, my name is Lucy. If in your first pregnancy you weren't able to deliver vaginally and ended up giving birth to your baby through cesarean section, in your second pregnancy, if you don't want to go through cesarean section, you want to go through labor, you are going to go through what is known as trial of labor. What is trial of labor? For the fact that in your previous pregnancy you've undergone cesarean section, in your second pregnancy, if you don't want to go to cesarean section, what you are going to go through is what is known as trial of labor. You are trying to know if you are going to labor till you deliver. So the way you've been treated is not going to be the same with someone that's never attempted cesarean section before. First of all, if you done cesarean section before, there are some conditions that must have led to you doing that cesarean section. It might be because your baby position is not right, or the baby is too big, or you have what is known as cephalopelvic disproportion, when your pelvic bone is too small for baby to pass through, or you developed a health condition that warrants you going through that cesarean section. So before you even attempt going in for labor in your second pregnancy, you should as well make sure that it is your midwife or your doctor that is preparing you to go for trial of labor. And that's why many women always lost their lives. That's why many women lose their lives, because they don't want to deliver through cesarean section. They will go to maternity institutions to force labor to occur without minding what warranted the first cesarean section. If it is because of your health condition, it might occur again. If it is because you have CPD, definitely it will still occur again. And by the time they will rush that woman to the hospital, is either the uterus have ruptured or they have ended up losing their baby. So first of all, before you go in for trial of labor, make sure that you've been scheduled by your midwife or your doctor. They've assessed you and they believe that you can go in for a trial of labor. One. Secondly, before you go in for trial of labor, make sure that the type of scar that was given to your uterus is the type that you can use to labor and nothing will happen. If the type of scar they gave you at your uterus is the type that you cannot really use to labor and you are forcing yourself to labor, you might end up having uterine rupture. And again, if you must try this labor after cesarean section, you must do it in well-equipped hospital that has emergency measures situated in, like there will be an emergency response if there is any emergency that occurs. Because why it is called trial of labor is because you are not sure if it's going to lead to vaginal delivery. You are trying to know if it can actually lead to, so you are trying it. And when you try it, it fails. The second option is cesarean section. So you cannot go to maternity house or go to prayer ministry or go to PHCs when you have done a cesarean section in your first pregnancy. If you must do trial of labor, it must be in a hospital. And you must be scheduled by a midwife or your doctor who have examined you and believed that you can actually try labor. so that when it fails, you can be rushed to theater. Another risk that is in this style of labor is that it always leads to rupture of uterus. And in trial of labor, you cannot be induced. Some will take themselves to these maternity homes, and because they have decided they're not going to do cesarean section the second time, a nurse that is there, I don't know if the person is a nurse or I don't know, whoever he or she might be, will start induction. If you have done cesarean section before, there is no how they will use prostaglandin to induce labor for you. It's not possible. And even if they are going to use oxytocin drip, it's going to be half strength of what it's supposed to be. And both the woman and the child will be monitored closely in case of any complications. So I'm sending it as a message and also as a warning. For those women that will have that must have done cesarean section in their first pregnancy, and you decided you're going to deliver your baby vaginally without considering what led to that first cesarean section, without considering if you are a candidate for trial of labor, without considering if anything should happen, is there any emergency response that can come to your rescue so that both your life and baby will be saved. So please always put all these things in consideration, especially when you must have done cesarean section before. Another thing I want to drop is this. I have seen a woman that did cesarean section in her first pregnancy just because her labor wasn't progressing despite all the measures that were given. Her labor did not progress. She went in for cesarean section. Then in her second pregnancy, it occurred the